Buen día, estamos aquí durante el Congreso Argentino de Oftalmología. Tenemos un invitado especial, que es el Dr. Kish, de la Universidad de Cornell, de New York. Es un excelente cirujano y médico clínico retinólogo. Y vamos a hacer una pequeña entrevista acerca de su gran experiencia que tiene con la familia de equipos de Optos, tanto en Daytona como en California. Y bueno, que nos dé algunos tips para usuarios y para médicos que están pensando en adquirir esta nueva tecnología. Good morning, Szilárd. How are you?
Good, good. It's a pleasure to be here and good to see you again, down in your home country.
Thanks for coming.
My pleasure.
So, please introduce yourself and tell us about your practice in New York.
So I've been in New York now for about 10 years. I had the retina service there where we had 9 physicians in the retina service, about 35 total physicians. And I spend about half my time taking care of patients. And those are all retina patients, surgical and medical patients. And my medical patients, just like you, I've got the diabetics, the macular degenerations, the vein occlusions.
So mainly you work with in different offices. You go from one to the other, and you have doctors or optometrists that help keep all the studies, and then you come pop up. And how do you work?
So we have one
daily?
main office. Yes. The main office is on the Upper East Side, and then we have 3 satellite offices throughout Manhattan and New York. I'm out of the main office.
Okay.
My colleagues go to the other offices. And the way that our flow works, our clinic flows, a technician will call a patient back, do the usual vision and pressure and history, and then everybody in my office gets an Optos and an OCT. I may not bill for it, but I find that invaluable. So once the patient is dilated and they get the pictures, they come into an exam room, at which point I go in. And when I go in to see the patient, I've already seen the history, I've seen the Optos, I've seen the OCT. It's almost a formality to talk with them and examine them.
So it's great that this new equipment gives you a lot of efficiency in the way you see patients. And
no, absolutely, absolutely. Whether it's the patient with a posterior segment pathology coming in for their injection for macular degeneration, or whether it's a diabetic patient or somebody with flashes and floaters, you get a good sense even before you walk into the room what the pathology you're facing. Somebody comes in with flashes and floaters in a visual field cut, you see that retinal detachment, you're already thinking about booking the patient for surgery even before you've met them.
It's incredible. So in my practice, I also sometimes you see a retinal tear in the Optos, and you don't even know the patients, and you are already thinking about what to tell them. No, it's incredible. So think about working with or without. Let's suppose you have to work in another state and you don't have this technology available. What are your thoughts about that?
It would be very difficult. We have trainees, we have residents and fellows. We have 3 fellows who trained with us for retina specifically. And the most common complaint I hear is if they go to a practice that doesn't have Optos. And the Optomap and the color fundus photo is one thing, but when you're doing a fluorescein or ICG, to have that small view and then having now the technician trying to get those frames in the periphery, like one of my colleagues said who went to a practice in Chicago, private practice, the non-wide field fluoresceins are almost useless.
It's incredible how it changes the way of thinking and seeing the pathology. So what are your main indications of telling people to go on angiography, ultra-wide field angiography? The main indications.
Most of my diabetics. If your diabetes is uncontrolled, you're coming in for a first visit, I want to get a sense of how much disease you have. And the fluorescein angiography really gives us that sense. Your hemoglobin A1C is above 10, you haven't seen an eye doctor ever, you're having some floaters. I want to show the patient how much pathology they have. I want to sort of scare them and also get them to buy into the treatment paradigm. When I show them a normal optomap of a fluorescein, and then their fluorescein with areas of ischemia, neovascularization, it really helps explain the level of damage and why it's important to really treat the eye. Even if they're 20/20, you know, some of my patients come in, they're diabetic, uncontrolled, they're 20/20, say, "Doc, there's nothing wrong with me." And I show them a fluorescein angiogram, there it is, that's the pathology.
It's incredible. So people often think that this technology is for us, retina specialists. What are your thoughts about that?
So it's not, you know. One of the programs that we started about 2 years ago is trying to get primary care doctors to take photos. And what we have, even on the Upper East Side of New York, is a lack of patients coming into our offices. You know, I practice, thankfully, in one of the wealthiest zip codes in the United States. And even there, our commitment to see our diabetic patients is less than 20%. There's no barrier to insurance. We always have an appointment time, and yet patients don't come in to see us. So an initiative we started about 2 years ago with Optos is to put Daytonas in primary care offices. So when you come in as a diabetic patient or anything else, you get your blood pressure, your weight, and while you're waiting to see the doctor, the nurse will actually take an optomap, an undilated image. That image then is transmitted to my office, and I see it. We've done close to 700 images, and about 10% of those patients have come in. And they've come in for a variety of things, you know, whether that's diabetic retinopathy, a nevus, a retinal tear. All of these things are caught in a primary care office. They don't necessarily have to come to see me unless I find pathology.
So this is the thought that I think about. The Daytona is really great for primary care also. And we bought the first Daytona like 5 years ago, late 2014, and nowadays we have 2 Daytonas working together, and every patient that comes in our clinic, they get a Daytona. And is there any wow effect on patients in New York? When they
absolutely.
get the Daytona and they see the image of the ultra wide field image?
Absolutely.
Because people in the States are really, they don't get a wow effect very often.
Yeah, and they're very skeptical in New York, you know. You tell them that they need surgery or they need an injection. They want to know why, you know, are you just doing it because you're going to make money off of it? And showing them and their family members. So yesterday before I flew out, I had a patient, a VVIP come in, and he had 2 days of the visual field cut inferiorly. And before I walked in the room, I saw he had a detachment. And knowing I had to catch a flight, I was already booking him before I walked in the room. But of course, I meet him, I walk in, and the second thing I say to him after hello is, "You need surgery." The skepticism was there, you know, why this and that. And then I pull up his optomap, and this was the right eye that we were looking at. I show him where the detachment is, I show him the retinal tear, and I say, "This is why we have to go to surgery. And look at your left eye. This is sort of what normal is." So there's absolutely a wow factor, and there's a factor of buying into the treatment paradigm. You know, in the US, there's this patient satisfaction, and there's this conflict sometimes between what a doctor says and what a patient thinks they need. And the Daytona, the California help them buy in to their treatment paradigm.
It's really great. Do you think this equipment will help us or help the artificial intelligence like built in and help like primary care facilities to get better diagnostic tools?
Absolutely. So the goal is to have these Daytonas or something akin to a Daytona in facilities that are not ophthalmological, and to have patients get pictures and then have the artificial intelligent machine learning algorithms make those diagnostic recommendations. So at first, you know, should you go see an eye doctor, should you not? But then I think as the technology gets better, it'll tell you that you may have a nevus that has certain characteristics that will require you to follow up in 2 months, or it has characteristics that may not require you to follow up for 2 years. With the wide field imaging, the confidence that you have is much greater that you're catching the necessary pathology, especially things that are in the periphery, tears, diabetic retinopathy and such.
And to follow up like diabetic retinopathy, it's really lovely.
Yeah.
So the final comments, can you like tell like a brief comment to an eye doctor that is thinking about acquiring these technologies, some tips?
Absolutely. You know, we started working with ultra-wide field imaging about 12 years ago. And within the field, there was a lot of skepticism because the pictures looked nice, but nobody had shown whether they actually improved diagnosis or follow-up. Now the pendulum has swung. It's very clear in almost every disease that we look at in the retina that it's not only the wow factor, but it's the so what factor. And so I think as people look for technologies to take this ultra-wide field imaging, Optos is the way to go. And you know you've done something good when people start imitating you. So there are several companies that are trying to imitate the ultra-wide field image. Unfortunately, they can't do it in one screenshot. You know, what I like is in one shot, in an undilated pupil,
Absolutely.
You get 200 degrees. And so as people look at technology, that's what I would recommend, is to look for something that's going to be here to stay, and that's the gold standard.
Thank you very much. It was lovely speaking with you.
Thank you. Pleasure.